Hello, faculty, and welcome to the 14th week of the semester. Hard to believe, but we are pretty close to the end here. So this week we have care plans. First year students are doing care plans on Tuesday morning and on Thursday morning. They have created PowerPoints sharing details about the patient's cases. They're writing their papers, and then they'll be sharing in their small group format for about an hour and a half, and then we'll get everyone together from 10:30 to 12 for the large group format discussions for care plans. Outside of the care plans, each student has 5 clinic sessions left in order to complete their requirements. Most students are done with their skill evals. There's a few outstanding biofilm bleeding indices and calculus on a patient. Most students are close to completing their total number of patient requirements, but that I think is what we will be the busiest with over the next 2 weeks, is getting those classifications and age groups completed. I think probably the biggest challenge this week and next week is going to be just keeping the students busy and professional until the very end of clinic. So they should be working on clinic activities, stocking their units, organizing their binder. Those are all professional clinical activities they can be participating in. They need to be in their full uniform. They shouldn't be just, kind of standing in groups, hanging out, chit-chatting. We really want to keep them productive until the end of the session. So I'm going to ask for your help on that, please. Otherwise, I don't have too much to share with you. We're doing great. As I said, everybody's on track. Dentists, I am going to ask that you please, before you leave the room, especially after an exam, you've completed all the forms for the patient, especially the clinical findings. If that doesn't get completed, the patient has to get another exam on another day, sometimes by a different dentist. So it's much easier if you could please just make sure that all of your documents are completed before you leave the room, and then we don't even have to worry about it. If there's anything that you need, anything I can do for you, please don't hesitate to reach out. Otherwise, I hope you have a really nice week.